Hello everyone. Sweden has been following an unusual strategy to keep the novel coronavirus under control. Unlike its neighbors and unlike many other European countries, the country chose not to impose any lockdown measures. Growing case numbers, however, in the capital city Stockholm and nearby Uppsala have prompted a rethink in the way of thinking a fight against the coronavirus. Authorities in the worst affected areas will have the power to strongly recommend people to avoid public transport, busy public places, and contact with those who considered most vulnerable, like the elderly. We will listen to my guest, dear Staffan Swartling Peterson, and learn more about what this move means for Sweden and how it will affect the country's strategy to fight against the pandemic. Dr. Peterson is a professor of global health at Uppsala University. Until recently, he was the chief of health at the United Nations Children's Fund, UNICEF, and he is also the co-founder of Doctors Without Borders Sweden division. Welcome, Professor Peterson.
Thank you. Pleasure to be with you.
Thank you so much for being my guest for this interview. I would like to start by asking you about what is actually happening in Sweden at this moment. What is changing, I mean? Yes, authorities in the worst affected areas will have the power to make strong recommendations, we said, but where are these worst affected areas? And we know that Uppsala is being one of them, and which authorities are we talking about now?
Yes, thank you. Yes, I live in Uppsala, Sweden, which is a university town with about 200,000 people. And what we saw was, of course, that in the spring, in March, April, May, we had a lot of virus transmission, but that was before we had widespread testing. So we couldn't actually detect the cases, but we did see that the hospital was getting full and we were losing a lot of elderly people in elderly care institutions. Then over the summer, we were all out of school, out of work, and the summer weather was nice and everyone was outdoor, and the cases fell down to a very low level. And now coming back to work, coming back to riding buses, coming back to town, etc., we have seen the cases starting to go up again. And it is in people who are between 20 and 50 primarily that we've seen the cases rising. And then with a certain, and we know this now because we have more widespread testing, we've also seen that we see more people coming to hospital again, which of course is a delay of a week or two after you get infected. So what the authorities have done now is actually in Sweden in general to say that yes, we have localized outbreaks. Uppsala is one of them. Let us not have one recommendation for the whole country. So the public health authority has said the local authorities can now actually issue local recommendations. So that's what we're seeing in the case of Uppsala. The local county council now has issued local recommendations for how we should stop the transmission. And it's not because, or slow the transmission. And this is not because we are in a situation like we were in March and April, but the cases have been going up.
The word recommendation seems to be the key to Sweden's coronavirus strategy from the very beginning. And now we are talking about also high-risk areas, new measures to keep the virus under control, but still the word recommendation is there. So what does it tell us about the nature of these new measures? Yes, we gather that there will be local measures, but will people be obliged to follow these rules? Can we call them rules or laws, or will there be any sanctions against those who are not following them?
Thank you. Yes, I think this is where Swedish history is one where we have a lot, generally I would say, a lot of trust in government. And Swedes like to follow recommendations and rules. Obviously not everyone, but many people. So the tradition of Sweden is to issue strong recommendations and then count on us to follow and also to sanction each other, as it were. To say, but there's a recommendation, why are you doing this? Telling my friend and my neighbor, etc. So that is the strategy. And the government and the local authorities think that actually we will have a better sustainability of the measures if we actually trust people and we make them recommendations rather than trying to implement rules. And because the other side of implementing rules is, of course, that you need someone who follows up on the rules and someone who gives out the fines, etc. So if you want to be serious about sanctions, then you better implement them. And that also has its problems. It's easier to say than actually to do. So in the case of Uppsala now, what is happening is that all of us are recommended, if we can, to work from home. That's why you see me in my messy home office now, rather than at work at the university. We are encouraged strongly not to ride the bus unless we have to. And that's when I was out this morning, I was biking in the rain instead of riding the bus. In fact, some of my older children also have to follow school from home, while the younger children still go to work. So there are a number of such measures that are strongly recommended, and I would say by and large, people follow them.
Looking at the whole process since March, since the whole pandemic started, the first cases being detected and spreading globally, how do you evaluate Sweden's strategy? In your opinion, was this shift, for instance, giving more power to local authorities to make strong recommendations? Was it necessary? Does it make the situation, or will it make the situation better? It's because it's quite new. Starting from Monday, the talks have been started about it, to keep the virus under control. What do you think about the overall process?
I think in general, if we look back to the beginning, Sweden, as well as everyone else, underestimated this virus. We didn't know it, and we thought it would be like other influenzas and other viruses that we had had. Sweden, I think, proceeded on an approach that has been used for other pandemics and other epidemics, and decided not to do a general lockdown. For reasons that we thought that with the government, the public health authorities said that I think it's about the sustainability of the measures. Because if we do a big lockdown now, maybe people will get tired with these measures and not follow them later, sort of the lockdown fatigue that is discussed in many countries. I think it was also the strategy that was chosen was to allow transmission to go on, to keep it as low as possible through various measures, but to protect vulnerable groups. And I must say that we failed miserably to protect vulnerable groups. And those are the elderly who are in nursing homes. And it's also people typically of immigrant background who have service jobs, who maybe work in the same nursing homes, who were maybe not reached by the information in their local language, etc. So I think the consequence of how we tackled this in the spring led to a number of deaths in vulnerable groups that could have been avoided if we had done more stricter measures, or if we had also implemented better protection measures. But as we recall, at the time in the spring, there was a general lack in the world of personal protective equipment. Everyone wanted face masks and so on at the same time, and you couldn't get them. So in this case, what Sweden did was to prioritize the healthcare, the hospitals, but not the nursing homes with the available equipment, and the virus got in. We had also asymptomatic or pre-symptomatic transmission, which we didn't know in the beginning. So by and large, I would like to say that we've failed on protecting the vulnerable groups. With the virus coming back now, it appears that it's coming back in a milder way than it did in the spring. We still have the challenge of protecting vulnerable groups. We now have a better situation with personal protective equipment, etc. Controversially, Sweden still does not really recommend or mandate masks, which is a big discussion item. Not that the masks in themselves are a magic bullet, they are only effective as one of many measures, together with keeping distance and washing your hands and staying away from people, etc. And many people, me inclusive, think that for certain situations, such as a crowded bus, or if you work in particular places and so on, masks would be a good addition to the Swedish control measures, but that has not been the recommendation from the Public Health Authority so far. I think the outbreaks we see now are regional and not nationwide. So obviously, now that we have testing ability to be able to follow where the outbreak is, it does make sense that we have a regional approach rather than trying to lock down a whole country or take measures across the country when the outbreak is local.
Yes, you just mentioned about the low number of people who are using the face masks, and I also would like to ask you about that, because last week when I had an interview with a Turkish woman who lives in Sweden for now 12 years already, dear Aslı Tepecik, she mentioned that 90% of people in Sweden don't wear masks, and sometimes this makes her feel a little anxious and worried about the situation. So what do you think about this, and do you think also this might change with the local authorities having the ability to make strong recommendations to people?
If I was deciding, I'm not the boss, I would say, why doesn't Sweden follow World Health Organization guidelines that we should put on a mask? And I carry one here in my pocket when we ride a train, when we work in hospitals, when we go into crowded shops, etc. I don't think that is going to happen because if I can say something, the general mood, as I interpret it in the population, is that people are not in favor of putting on masks. And I think that could possibly be overcome, but with strong recommendations from authorities. But I don't necessarily see that happening in Sweden for various reasons. The mask in itself, though, has become a bit of a symbolic piece, because if we look at the pictures around the world, half the people seem to be wearing their masks like this, leaving the nose out, and the rest are taking them on and off, and some of the masks look like something they made themselves, not necessarily effective. So I think we need to see that the mask is not the solution. It's part of a measure together with the other measures, and as such, I think it has a role and should be promoted according to WHO guidelines. What I see is that it's, as we all know by now, the mask doesn't necessarily protect me, but it does have the potential to slow down the transmission. And it also sends a signal, I would argue, that let me keep a distance from this person. I don't see the masks coming in Sweden. That's probably a problem on the margin. It's not a substantial problem, I would say, in terms of disease transmission, because unfortunately the mask is not the big solution that is sometimes made out to be.
Previously, as I also mentioned at the beginning, previously you were the chief of health at UNICEF. And I mentioned it for a reason, because I also wonder about your opinion when it comes to the debate on whether keeping the schools open or closing them down and letting students studying from home, or keeping the school from home. As far as I could follow, I see that you argue in favor of keeping the schools open. And I would love to hear it from you. Why do you think so?
Well, I think this is one of the areas where we do have evidence. One, coronavirus is not dangerous for children. The regular influenza is much more dangerous for children. And even in Sweden, which has now kept its schools open, its primary schools, I should say, throughout this period, we haven't seen one single child die from corona. We've had a handful of cases with the multi-inflammatory disease, and they have all become well. And if you compare this to the statistic of any normal year with the normal seasonal influenza, we actually lose one or two kids the deaths, and we have more serious illness. So one, corona is not dangerous for kids. Secondly, primary school age children do not transmit the virus very well. So all the measures that were taken in one country after the other in March and April there to close down the schools for 1.6 billion children in the world. 1.6 billion out of 2 billion children in the world didn't have a school to go to. They were not evidence-based. I would like to argue that they were made out of desire to look like you are making political decision and you are in control and you're taking strong measures. Gradually, countries have opened up schools, but last time I checked last week, 600 million children in the world still did not have a school to go to. And I think that is the biggest public health threat that we are seeing. We are losing a generation, because what does it mean not to go to school? Well, we pretend to do online learning, but even for children that have internet and computer, which many children don't, online learning works pretty bad. And we've made a big, Save the Children made a big investigation asking children around the world, and 80%, 4 out of 5 kids said, I haven't learned anything since this started, whether they attempted online learning or not. Being at home can also be very dangerous, because if you're locking up a full family and the parents lose the job, there is domestic violence, there is poor mental health. We see around the world that primarily girls drop out of school, don't come back. We are counting 500 million child pregnancies in Africa per year now, and we see child labor increasing. So, and this will be then followed by an economic recession when these children come out of the school and finish school, if they ever come back. So I think we are risking losing a generation, and we are doing this in a non-evidence-based way, because primary school children do not drive the epidemic. It's not, COVID is not dangerous for the primary school child themselves. They transmit very badly to adults and teachers. In fact, in Sweden, the Public Health Authority published a report showing that primary school teachers did not get more sick than any other professional category during the spring from COVID, even though they were teaching in open schools when most of us were working from home. And there is no evidence that actually schools drive the epidemic. That doesn't mean that you don't have to take a localized measure if you have a big outbreak. And what we seem to be indicating that from 15 years and up, somewhere there, secondary school, children start behaving more like adults. So in the case of Uppsala now, my 2 secondary school children, 16 and 19-year-old, from today, they are actually attempting to follow teaching from home by a distance. So yes, you can take measures. And in the case of Sweden, secondary schools now in some places have remote teaching. Universities have a lot of remote teaching. But primary schools should remain open, and they should open around the world. And we see this, and in my view, I think this is politically motivated. We see places where the schools are closed and the pubs are open, and that is the wrong priority. The pubs and the restaurants where adults go and hang out and get drunk and cough in each other's faces, those are the ones that should be closed. That's where the virus is transmitted. It's not the primary schools. So keep schools open and open schools now. We cannot afford to lose a whole generation of kids.
Dear Professor, thank you so much. It was a pleasure for me to talk to you.
My pleasure. And keep the schools open.
Thank you all for watching us. Stay tuned for more high quality content from Mediascope.